And now to this morning's health check. Houston's summer heat is in full effect, and sweat is nothing new to anybody who's ever lived in the Bayou City. But did you know there's such a thing as excessive sweating? Those who suffer from the condition have a variety of treatment options available to them, even though if they don't know it. Here with a look at the treatment options and tips to prevent sweat in Houston, in the Houston humidity, is board-certified plastic surgeon Dr. Young Cho. Good morning, Dr. Cho.
Good morning.
So obviously in Houston, everybody sweats.
Correct.
When do you think people should draw the line into excessive sweating?
So excessive sweating is really non-physiologic sweating. We sweat to release heat from our bodies, so in response to hot weather, it's very natural to sweat. It's when you're indoors, it's cool, it's wintertime, you have not the normal conditions for sweating, but yet you're sweating excessively. It can happen in the forehead, in the scalp, in the face. It can happen in the armpits, which is very common, in the hands, in the soles of the feet, in the groin area. So when it's non-physiologic excessive sweating, it starts to put a very big negative impact on your lifestyle, your social interactions, your work, going to school, etc.
So what can people do? I mean, is there a magic pill? Is there a magic bullet? Well, what can people do to stop this?
So one should always try some of the least invasive things first. So antiperspirants, they do work up to a certain degree. You can take some oral medications that can help dry out some of the secretions in the body. But when those things start to fail, you can start turning to things like Botox, which you may have heard for facial wrinkles.
Sure.
It also works on the sweat glands, so it can stop the sweating process for anywhere from 3 to 6 months, depending on how you respond and what dose you use. For the armpits, we have some more exciting options. We have a procedure called mirror dry. Mirror dry is a microwave technology, so we're actually heating the sweat glands underneath the skin. It's usually 2 treatments spaced about 90 days apart, and then you get your sweating down to a very controllable level where it's back to normal or less than normal even. And I also have a procedure where for the armpits I do surgery where I physically make a small incision. I elevate the sweat glands off the underlying tissues, I remove the sweat glands and then put things back together, and that virtually stops the sweating.
When people come to you, are they at the end of their rope? Are these folks who have been dealing with this for quite some time? Are they just looking for anything that'll help them, and are they unfamiliar with some of the options that are out there?
Absolutely. So a good 3 to 5% of the population may be suffering from excessive sweating. They're suffering in large part because they don't know what the other options are, or they've been using antiperspirants or oral medications. They don't like the side effects, and they're looking for something that gives them more relief. And so when they hear from friends, or they look online, or they're watching TV and they hear about excessive sweating and that there are good options out there, they say, okay, I know this is for me.
Are a lot of these covered under insurance, or is this something that the patient has to incur themselves?
In some cases, they may be covered by insurance, but some of the procedures, just like antiperspirant, may not be covered by insurance. Some of these newer procedures are also not covered.
So have them give you a call, see what you can do for them.
Absolutely.
Right? All right. Well, thank you much, Dr. Cho. Appreciate it.
It was a pleasure to be here.
Great job. We didn't break a sweat. You can find all the latest health-related headlines on our website, abc13.com.